All right, everybody. You can see the VIP bouncer has removed the stanchions. So now you are welcome to come in and take your seats. And we'll get our program started at about 6 o'clock. So that's in 8 minutes. You can grab your final drink if you'd like. Load up a plate of food. There is enough food to feed all of us 3 times tonight. So please grab a plate of food. There's dessert that you can grab. Coffee is set out. And again, you can grab your final drink at the bar. The bar in the reception area is going to close down shortly, so we can begin our program at 6 o'clock. Finalists, you can take a seat in the front row. Sponsors, Pathfinders, Trailblazers, we have reserved seats for you as well. And again, seating is available for the awards ceremony now, so grab your food, grab a drink, and come on in and take a seat. Thank you. All right, once again, come on in, take your seats. We're going to get our program underway shortly. So come on in and take your seats. And again, if you are a finalist, you can sit in the front row. Our sponsors, Pathfinders and Trailblazers, we've got reserved seats for you, so look for reserved. But come on in, please take your seats. We're going to get our program started in just a few minutes. right, we're closing down the bar. Thank you to everyone finding your seats. You can bring food and drink with you if you'd like. Grab that final bite. But we're broadcasting this to the world, so we're going to start very shortly, so we keep on schedule. All right, everyone, come on in, take your seats. I know we have people watching from home. Hello to our virtual viewers. Hopefully you're taking a while to take your seats at home too, so that you're matching the sprint that's happening in here. It's hard when there's free food and drink. So come on in, take your seats. Thank you, everybody. Look at this. It's very quiet now. All right, well, welcome, everyone. Thank you so much for being here. Again, there are seats if you are just joining us. Come on in, take your seats, find an empty chair. You don't have to stand in the back. You're welcome to come sit. It's going to be about an hour that we spend together, and so come on in, find that seat. My name is Fred Northup Jr. I am thrilled to be with you in person. How about this? Isn't this fun? This is so, yeah, we can make noise. We have the museum all to ourselves. We won't hurt any artifacts, I promise. Well, I'm going to pop this out. It is my great pleasure to welcome you to this year's Global Health Impact Awards. And tonight, of course, we are here to celebrate this year's winners of the Washington Global Health Alliance's Global Health Impact Awards. Of course, the hard work and dedication of global health professionals often goes unrecognized. And so that's why we're here tonight. We're here to honor the incredible impact that the global health community makes on lives around the world, and to highlight the achievements of the Global Health Impact Awards finalists. Now, last year, we did this virtually. I'm sure all of you watched it. You probably still keep watching it over and over since it's on YouTube. Thank you for all those dozens of views that we're racking up. And Maurizio said he refused to do the awards in person, again, unless three things happened. It had to be a perfect sunny day. We're like, okay, we'll see what we can do. The West Seattle Bridge had to reopen, he said. And we're like, all right, we'll take care of that. And then he said the Mariners had to be in the playoffs. And we're like, no, that's seemed like a lot, but he makes things happen. He can, whatever, he gets it done somehow. So thank you. I'm glad that we were able to gather again today. We're going to bring up our series of speakers. You might notice safety first. We have this set of stairs right here, right there. So somewhere in Seattle tonight, a small child can't wash their hands. But we have that, so feel free to use that. So please join me in welcoming Prabha, the chair of WGHA's Board of Directors, to the stage. Safety first.
So, how did you do this? Okay, all right. Well, welcome, all of you. I'm so glad to see everyone here in person. And also, we're streaming. I hear we are on YouTube again this year. And we expect more likes from all of you. Now, watch that every single day as part of your morning routine. So, what do that? Okay, so, before we begin our program today, we want to take a minute to ground ourselves and to respectfully acknowledge the land that we are here today. For those of us here in person and in the Seattle area, we acknowledge that we are on the unceded territories of the Coast Salish people, including the Duwamish, past and present. We invite each of you to learn more about the tribal land you occupy and to truly commit through words and actions to demonstrate respect, support, rights to the true owners and caretakers of these lands who are still here today. I would also like to take this time to congratulate all of our finalists. I see many of you here in the front seats. And the selection of our finalists was extremely competitive. I was part of that committee that went through all of your amazing accomplishments. It was a hard time as we were deciding, how do we pick the top one or top three or even top five. It was fantastic to see that. And especially during COVID times, we've had an opportunity to make such a big impact across the world. The impact of your work on behalf of the entire global health community, reflects the importance and value of the work that we do on an everyday basis. And we in WGHA are very honored to be here with you this evening. To all of our guests, I am again glad to see you here in the room, in person, and on video. Thank you for showing up to our event today. And we are very grateful to have each of you with us, celebrating the contributions and achievements of our global health community as a whole. Thank you also to my fellow board members. I see many of you around the room. And the small yet mighty team at WGHA who's made this event happen, but also every day works towards promoting our global health agenda. And now, to get this party started, because we got all his 3 things done, I'd like you to welcome the President and CEO of WGHA, Maurizio Vecchione.
The challenge of getting up here on the little steps is nothing compared to the challenges in global health that you're all dealing with. So I think it's a bit of a test. Before I tell you a few remarks that are probably going to be much less entertaining than what Fred said, but I do take full credit for the Mariners. Even though those of you that know me know that I spend a lot of time in LA, so I have to contend with a different team down there that is also aspiring to greatness. We are here at the Natural History Museum today, not just because it's an interesting venue, but because there is an emerging trend in global health that I want to recognize before giving you my remarks, which is the role of climate and planetary health in health. And if you are wondering why we seem to have increased pathogenicity in a number of infective diseases, If you're wondering why the frequency of pandemic potential emergence of bugs is accelerating since 1988, according to the WHO, it's not an accident. We are in a giant petri dish and the temperature is going up. I'm actually very happy to recognize in our audience today members of UW's School of the Environment and working in climate research, who are also looking at microbiological impacts from the planet into health. And I think that's something for all of us to think in terms of the increasingly complex landscape of problems that global health is trying to tackle. So thank you, Prabhat. And really on behalf of our team at the Washington Global Health Alliance, our board of directors, we are really glad to have you here today for this special night honoring the global health individuals and organizations that have really delivered on impact, and often in impact through innovation on a global scale. The Global Health Impact Awards is on its second year. And it's an event designed to recognize the incredible innovation that the global health community is making in human and public health. The pandemic has and continues to provide incredible challenges for people globally. Yet, the members of our alliance have been pivotal in addressing those challenges while also addressing the welfare of people everywhere. To achieve this, our entire community has had to be incredibly innovative, and tonight we're going to celebrate some of that innovation. Thank you for being here tonight, and as we celebrate our annual awards. We're thrilled to celebrate the work of our global finalists with all of you tonight. 2 years ago, we celebrated our collective journey and how the global health sector rose to the occasion that the pandemic presented. Last year, we celebrated our first cohort of innovators that embraced the new global challenges and turned them into solutions that are improving public health globally. We didn't fully comprehend then how much further we would need to rise as a community and for how long we would have to sustain that effort. The collective tens of thousands of hours of tireless and often heartbreaking work to deliver critical healthcare and develop the vaccines that have and will save millions of lives. In this journey, we had to confront that what we call global health here in the global north is just public health in the rest of the world. We had to realize that as a global health community, we have much to learn about leaving behind notions of neocolonialism that still often pervade global health programs and embrace equity and local empowerment. Only by truly embracing global collaboration and equity can we deliver the kind of innovation that can move the needle in solving global challenges in front of us. To meet the needs of people everywhere, we must constantly evolve and engage with governments and communities in ways that are truly inclusive and equitable. The Global Health Alliance is committed to advocating for and improving our understanding of the intersections of health, gender, race, economic equality, and to increase our impact in these areas to bring about equity in all health access. As a community, we're doing better, but we must do better still to achieve this goal, and so we will. The need to collaborate, share, and communicate is critical for equitable innovation in our sector. If innovation is not grounded in inclusion, it is not likely to be impactful and scalable. This is why WGHA decided 2 years ago to embark in an ambitious project to help our membership share ideas, collaborate, and execute on innovation that can both be disruptive and groundbreaking in its impacts. This work is culminating today with the unveiling of our Global Health Innovation Exchange, a program at WGHA that federates innovators in global public and population health with corporate and funders to foster the emergence of innovation-based solutions addressing humanity's most daunting problems. In this vision, innovation is not limited to new technology or new science. Global learnings, implementation science, program innovation are also critical to this translation into achieving impact, as demonstrated by the incredible innovation happening in response to the pandemic. To accomplish this, our Global Health Innovation Exchange fosters interdisciplinary collaboration, trying to overcome intersectional inequities and limitations. Successful translation of innovation into solutions require collaboration between researchers, academics, implementers, industry, funders. Problems in the local village means problems in the global village. We must care, collaborate, and coordinate with each other globally. Our innovation exchange brings together a multi-sector approach to solutioneering. Local, on-the-ground organizations can partner with research and corporate innovators in an ecosystem approach that can identify problems together and drive solution and scalable approaches. Global health requires investment in research and technology. The COVID-19 vaccines were able to be released quickly, in part because years ago, investments had been made in mRNA technologies. The global and public health sectors need a long lens to anticipate what may be coming. And the public and academic sectors need to partner with the private sectors to drive the scalability and implementation. Our Global Health Innovation Exchange proposes to be a collaborative ecosystem that allows each of these stakeholders to identify priorities, drive solutions together, and ultimately partner with the private sector and industry to implement. Members of our exchange will find common frameworks for innovation development, intellectual property development, compatible with global access methodologies, and perhaps ready and willing funders that collectively can partner together in support of the global health priorities. I'm particularly proud to announce today our anchor new member of the Innovation Exchange, the UN Technology Bank. The United Nations Technology Bank for the Least Developed Countries is a global organization dedicated to enhancing the contributions of science, technology, and innovation for sustainable development in the world's 46 least developed countries. The UN Technology Bank helps the least developed countries build the science, technology, and innovation capacity that they need to promote the structural transformation of their economy, eradicate poverty, foster sustainable development, improve health. They're ready to partner with our innovators in our ecosystem to help implement the kind of innovation needed at the bottom of the economic pyramid, and that can possibly also improve health everywhere. To all industry, innovators, academics, entrepreneurs, venture capitalists, and funders, you have my invitation to join our Global Health Innovation Exchange. Let's change the world together. The Alliance has a vision that people worldwide will have equitable access of healthcare and experience the same outcome regardless of where a patient may be located. There is no equity without universal access to healthcare. By focusing on needs developed in the 46 least developed countries and by deeply partnering with those communities, we're hopeful that our exchange in partnership with all of you can engage in the kind of reverse innovation that can ultimately scale globally. The Alliance with our exchange is exploring relationship with non-traditional funders, especially around the gap in funding areas that our members are asking for help with. Our new Global Health Innovation Exchange is also acting as a catalyst for some of this funding. It can provide a mechanism to fund emerging areas of research and of possibility in global health. In this context, we're also excited to announce that Adastral Funds, an impact venture capital firm focused on population and global health, has also joined the Global Health Innovation Exchange and is ready to work with our innovators and partners to drive entrepreneurship in our sector. WGHA Global Health Industry Landscape, published earlier this year, has shown that the global health sector is responsible for over $8 billion of economic activity in the state of Washington alone. These numbers suggest that our sector is in high growth and provide a significant validation that investments in our sectors can be scalable and will provide financial returns to the impact investors. The Alliance is grateful for all of our members and so proud of you. We're here to advocate for the long-term health and welfare of our fellow citizens on the planet, to use our collective voice to amplify and improve equity and access for all of us. The Alliance is about connection, community, and a collective platform to advance your mission. We'll help our members understand and implement the best practices, interpret learnings, and brainstorm the future. Our Alliance has global reach and influence. To continue to drive this innovation, our nonprofit organization always needs your support. Any donation you choose to make to WGHA, as well as the ticket purchases for tonight's event, make it possible to support and amplify our work and the work of our members. Thank you. Thank you for all of you for developing the next generation of leaders in countries where you're working. Thank you for making Washington a powerhouse in global health. Because of your generosity, in last year's event, 2022, was rich with speakers, conversation, and emerging talent. We can't wait to see what 2023 will bring. How far we'll go depends largely on those of you in the room with us tonight. We also want to extend a very special thank you to our members and the generous sponsors for tonight's event. To help us celebrate the achievements of our sponsors and our winners, welcome Megan Batillion to the stage.
Long legs means I can skip the stairs. All right, so thank you, Maurizio. As the Vice President of WGHA, it is my great honor to work with the wonderful organizations and individuals that have helped to sponsor tonight's event. It is with deep gratitude that we thank our hero sponsor, the Bill and Melinda Gates Foundation. Last year, the foundation funded 2,051 grants for a total of $6.7 billion in support. We all know how critical the foundation's support is to delivering health equity around the world, and we are profoundly grateful for that support. Our champion sponsors tonight include Ad Astral, Fred Hutch, Grail, ScienceWorks, and We Work for Health. Ad Astral is a team of scientists and inventors who believe that solving global problems can bring extraordinary financial and social returns. They are proud to support the work of WGHA, and there is, as Maurizio mentioned, a little bit more on that exciting announcement later on in this program. Fred Hutchinson Cancer Center unites comprehensive care and advanced research to provide the latest cancer treatment options and accelerate discoveries to prevent, treat, and defeat cancer and infectious diseases worldwide. This year, Fred Hutch conducted over 800 clinical trials and collaborated with scientists around the world in over 15 countries. Grail is a healthcare company whose mission it is to detect cancer early when it can be cured. They're developing a multi-cancer early detection screening called Gallery, a test that measures for the presence of cancer tumor DNA in the bloodstream. The Gallery Clinical Development Program consists of studies that collectively include more than 335,000 participants around the globe. Every day, thousands of biopharmaceutical researchers across Washington state work in pursuit of innovations that improve our health and well-being. But too often, their innovation-driving research goes unnoticed. The ScienceWorks campaign is changing that by shining a spotlight on the vital role by putting forward their personal stories front and center and reminding people that they can trust science. Our biopharmaceutical sector is the foundation for one of Washington's most dynamic innovation and business ecosystems. We Work for Health Washington seeks to educate our communities and leaders that serve them about these key contributors of the life science sector in our state. And special thanks to our guardian sponsors, Forum One and Providence. For the last 3 years, Forum One has won multiple communicator awards from the Academy of Interactive and Visual Arts for our digital agency work with key global health partners such as Johns Hopkins University Global Health Security Index, MacArthur Foundation's Lever for Change, and the Elizabeth Glaser Pediatric AIDS Foundation. Providence's vision for health for a better world and advocacy for health as a human right motivate their organizational commitment to advancing justice at the U.S. bedside and beyond through international partnerships. Within a time of global uncertainty, Providence has supported life-saving maternal and child health programming, grown technology-enhanced health system strengthening initiatives, and partnered to advance new specialties based on country-specific priorities. And of course, our advocate sponsor, Columbia Bank. Columbia Bank has long been a true advocate for nonprofits in Washington State, and we truly thank them for their long-term partnership with WGHA. I want to acknowledge WGHA's board members, many of whom are here tonight. Thank you, board. And WGHA's trailblazers and pathfinders. These people truly are the unseen forces behind WGHA, whose generous gifts help underwrite some of the less glamorous parts of our work. The trailblazers joining us tonight are John and Leslie Aitchison. I believe were not able to join us tonight, but K.R. Prabha and Umesh Wankede, and I know they're here because we just heard from Prabha, so thank you for joining us. And Maurizio and Andrea Vecchioni. And our Pathfinders in the audience tonight are Sanjay Cheda, Brooke Cutler, Jennifer Slava, Kirsten Gagnier, Eric Klender and Jennifer McCormick, and Flora Baramubalama. Thank you so much for joining us tonight. And finally, thank you also to tonight's incredible event partners like the Burke Museum, right? For hosting us in this beautiful venue, especially Jeanette, who helped us coordinate this event. Thank you, Jeanette. Off the Res for this delicious food, as well as the bartending services, right? Big shout out to our bartenders tonight, and the food was amazing, wasn't it? Also to our AV technician, Lucas. Hi, Lucas. And the editor for community video, Eric Hecht, and of course to Fred Northup Jr., our amazing MC, long-term friend of WGHA, and all-around great guy. So now, without further ado, we present the WGHA fan favorite segment of the night, our community video.
Providence, our vision of health for a better world motivates and propels us to innovate, even in the most difficult times, to ensure a positive social impact that is sustainable, actualized through partnership, and owned by those closest to the ground. This year, we grew virtual capacity sharing initiatives as a new component of our health system strengthening work. In partnership, we are reducing the digital divide, supporting and learning from providers around the world, and advancing global health equity.
In November 2021, WGHA supported the DRC Ministry of Health to launch a high-volume vaccination site, or vaccinodrome, in Kinshasa for the COVID-19 vaccination rollout. In the first month of operations, the first vaccinodrome in Gombe was responsible for 18% of all vaccinations in Kinshasa. After so much success with the first vaccinodrome, we ended up launching an additional 3 sites across Kinshasa to expand COVID-19 vaccine access and coverage. Over only 2 months, weekly vaccination rates increased by 125%. Using the successful model of our COVID-19 vaccinodrome work, Village Reach is transitioning the vaccinodromes to primary healthcare facilities to integrate COVID-19 vaccination to routine immunization services.
Caroline Nasimiyu, a scientist at Washington State University based in Kenya. Our research focuses on emerging and re-emerging infectious diseases, most of which disproportionately affect communities in Africa. Generating knowledge that may lead to positive social impacts within these communities motivates us to invent new projects. We have been in the forefront of providing evidence-based information by tracking the epidemiology of COVID-19 and the vaccination efforts in Kenya. Some of the positive social impacts from our work includes use of our findings by the government to inform mitigation measures such as movement restrictions leading to reopening of schools and resumption of businesses. Our findings were disseminated through policy briefs, publications, and community feedback forums.
Hello everyone, my name is Floribert Hengwa Mubalama. I'm originally from the Democratic Republic of Congo, and I'm the founder and executive director of the Congolese Integration Network, a non-profit organization based in SeaTac, Washington State. The voice of the Congolese government through the resolution 8651 that give a hand of friendship between the state of Washington and the Democratic Republic of Congo. Now the Democratic Republic of Congo have a voice in Washington State.
Hi, Eric Linder, Senior Account Executive with Linden Logistics and a Seattle Mariners fan here. We've had a rough few seasons in the global health supply chain, and when I need motivation, I look to our leaders in our community who have overcome adversity in these last few years, locally and globally. So as we cheer our favorite teams on the field, let's also applaud our colleagues in their fields as they cheer us on as well. Let's play ball.
It's always a highlight. So fun to get to hear from everyone. And thank you again to Eric Hecht, who edited that video. We're now going to hear from one of our champion sponsors, Fred Hutch, and let them share a few words. Take a look.
Good evening, Washington Global Health Alliance. The Fred Hutch is so proud to be sponsoring this event. The Fred Hutchinson Cancer Center is on a journey to become the most innovative, comprehensive cancer center for cancer and infectious disease in our region, our country, and possibly the world. In October 2021, we announced our intentions to restructure. In April of 2022, we announced the completion of the deal, bringing the SCCA, UW Medicine, and the Fred Hutch together. And on Monday, October 3rd, we formally introduced the new Fred Hutchinson Cancer Center brand to the public. By unifying two remarkable legacy organizations, Seattle Cancer Care Alliance and Fred Hutchinson Cancer Research Center, we'll be able to accelerate our shared mission of putting the world's most devastating diseases behind us. We're also honored to serve as the cancer program for UW Medicine, continuing our long-standing relationship and adding value for our patients through enhanced care coordination with one of the world's greatest integrated health systems. By working more closely together, our future is boundless and will rapidly create new hope for those we treat here and across the globe. Our Fred Hutch colleagues are working here in Seattle and beyond to accelerate life-saving science through coordinating vaccine trials on multiple continents and researching new ways of treating cancer in Uganda in collaboration with the Uganda Cancer Institute. Thank you so much, and we're looking forward to a fantastic event.
Thank you again to Fred Hutch for being one of our champion sponsors. Well, now, my friends, it is time to introduce our 2022 Global Health Award finalists. So we're going to start with our Organizational Impact Award. And the Organizational Impact Award was judged by evidence of better health outcomes and impact relative to organization size and budget, innovative approach, deference to local leaders, and collaboration among diverse partners. And this year's finalists are International Medical Corps, Partners in Health, and UNICEF. And this year's judging committee has selected International Medical Corps as WGHA's 2022 Organizational Impact Award winner. And so with that, I'd like to invite our representatives from IMC to share a few words. They were unable to join us in person, so we'll be hearing from them via the magic of that screen.
Good evening. Thank you to the Washington Global Health Alliance for this Impact Award. International Medical Corps is honored to be among such distinguished organizations that have made a tremendous impact on global health outcomes around the world. Congratulations to our colleagues at UNICEF and Partners in Health on your nominations. We are always happy to partner with you and other members of the Alliance. As a first responder to war, disaster, and disease outbreaks, International Medical Corps is on the front line of crises globally, including the wars in Ukraine, Yemen, and Syria, the hurricanes in Florida and Puerto Rico, and of course, the COVID-19 pandemic. As always, training remains the foundation of our work. Throughout everything we do, we strengthen the capacity of local healthcare systems. We educate local health professionals to become their own first responders. We ensure that life-saving skills stay in the communities where they are needed most. And as we look to the future, there is no doubt the road ahead is full of challenges. The number of forcibly displaced people is over 100 million, the highest in history. Health infrastructures and social safety nets are strained. Hunger, disease, and mental health crises are on the rise, while the shortage in the global health workforce is worsening. While these challenges may seem overwhelming, we have all witnessed the power of working together to face obstacles that on our own would be insurmountable. In fact, partnership is what makes all of us more effective. Together, we work harder and we work better. We stay true to our mission, and we know that every life saved and every community changed adds up. On behalf of International Medical Corps' board and our 8,000 team members around the world, thank you.
Well, congratulations again to IMC for being our 2022 Organizational Impact Award winner. We're so grateful for their contributions to the global health community. Now, I'd like to transition to hearing a few words from our champion sponsors, ScienceWorks and We Work for Health. So please welcome Adriana Stiphout, Senior Associate for Bristol Myers Squibb.
Washington-based biopharmaceutical scientists, like myself, are at the center of a vibrant global healthcare innovation ecosystem, committed to continued scientific advancement and meeting the urgent healthcare needs evolving across the globe. In order to maximize the innovation-driven research we conduct, people must have safe and timely access to new medicines. After months of negotiation, an important federal law called the Prescription Drug User Fee Act was just reauthorized by Congress, which keeps science working. Since first enacted in 1992, it has provided communities in need more timely access to over 1,700 new drugs and biologics. Washington's own U.S. Senator Patty Murray took the lead in championing this legislation with our life science community. Working in a bipartisan way, she has ensured America's innovation ecosystem can continue to produce safe and effective medicines. ScienceWorks is proud to partner with Washington Global Health Alliance in thanking Senator Murray for fighting to keep science working for all of us.
See, we've got a few people standing in the back. There is an empty chair here on the stage. If you want to, it's a great view right here. No? All right. Well, thank you again to ScienceWorks and We Work for Health for sponsoring our event. What? This? All right, nobody took it up. All right, that's fine. We also want to thank Grail for being one of our champion sponsors. I'd like to invite Max Brown from Desimone Consulting Group to share a few words on behalf of Grail right now. So here comes Max.
Hi, everybody. Max Brown here with the Desimone Consulting Group, appearing here on behalf of Grail, a California-based company whose mission is very simple, to enable patients to detect cancer earlier when it can be treated effectively, when the interventions are lower cost and there's better healthcare outcomes overall. Grail's working to make sure that patients can find the therapies they need through that earlier intervention and those diagnostics. Very proud to be here to represent them and to partner with the Global Health Alliance. Thanks very much for having me for a couple minutes.
Thank you, Max, and thank you again to our champion sponsor, Grail, for their support of this year's event. All right, now I'd like to move on to introduce this year's finalists for our 2022 Luminary Leader Award. This is awarded to an individual who has demonstrated exceptional leadership and a relentless commitment to the global health community. And you can see them up there on the screen. This year's finalists include Maria Elena Batazzi and Peter Hotez, Baylor College of Medicine, Pat Garcia Gonzalez, the Max Foundation, Umair Shah, Washington State Department of Health, and in selecting the recipient for this award, this year's judging committee looked for evidence of demonstrated impact on improving health equity and scale, legacy impact on their field, championing and driving collaboration, and meaningful mentorship. My friends, this year's Luminary Leader Award goes to Maria Elena Batazzi and Peter Hotez from the Baylor College of Medicine. And with that, take a look here at your screen.
Hello, and thank you for the opportunity to briefly address you, the Washington Global Health Alliance, to make a few remarks. First of all, thank you so much for the recognition. I'm speaking on behalf of myself and Dr. Mary Elena Batazzi, and together we head the Texas Children's Hospital Center for Vaccine Development and the School of Tropical Medicine at Baylor College of Medicine, where we develop low-cost vaccines for global health, including a new COVID vaccine for India and Indonesia that's been being widely used in those countries and hopefully soon elsewhere. I've been working with Washington State and Seattle-based organizations for as long as I can remember. The Gates Foundation, of course, but the tremendous Department of Global Health at the University of Washington and the Institute for Health Metrics and Evaluation, and the Fred Hutchison, and what used to be known as IDRI, now known as AHI, and back then Seattle Biomed, and your groups have been an extraordinary source of inspiration. And I always remember when I would fly to Washington, Seattle for one reason or another, and it was always an inspirational visit. I always learned so much. So to be in some way connected with you is very meaningful, and congratulate you on your event today, and I look forward to meaningful and longstanding collaboration. So thank you so much.
Greetings, everybody. Thank you, Peter, for the wonderful remarks, and I wish to join with a brief message and express what a great honor it is for me to receive this prestigious 2022 Luminary Leader Award and conferred by the Washington Global Health Alliance. What a privilege to have been nominated next to global health champions, Pat Garcia Gonzalez from the Max Foundation, and longtime friend, Dr. Shah, from the Washington State Department of Health. I greatly regret not being able to be in person and celebrate together the wonderful achievements and in a wonderful place such as the Burke Museum of Natural History and Culture in Seattle. Along with our team of scientists at Texas Children's Center for Vaccine Development at Baylor and in Houston, Texas, we have dedicated our work to achieve global health equity through the development of many vaccines, most of them against neglected and emerging diseases affecting the world's poorest populations. Our philosophy is anchored on open science and culturally appropriate partnerships. And as a result, our collaborations for COVID-19 now in India has led to Corbevax, the COVID-19 vaccine that now has reached more than 75 million pediatric arms. And now in Indonesia, where Indovac, a certified vaccine that received halal approval, is appropriate now for reaching many populations in the Muslim world. Thanks for recognizing our work in search of equity and justice. And we hope that the world can have access to better health through the use of our vaccines, but championing organizations also like yourselves. Thank you very much.
Congratulations again to our Luminary Leader winners. And now we're going to hear from our champion sponsor at Astral to share a few words. Take a look.
Good evening. My name is Alex Goldberg, and I'm a general partner with Adastral. Adastral is delighted to sponsor the Washington Global Health Alliance's Global Health Impact Awards. As a venture studio that focuses on the nexus between human and planetary health, we know how vital the work of global health professionals is to the betterment of the world. We believe that investing in groundbreaking new companies that develop precision medicine and climate change solutions is not only our responsibility as global citizens, but also the best way to achieve a strong financial bottom line. With this in mind, we are excited to announce that we are entering into an agreement with WGHA to be the first sustaining member of the Innovation Exchange that Maurizio mentioned earlier. I would mention that in addition to Adastral's investment focus via our ESG guidelines, we also analyze our investment opportunities using DALIs as a lens to ensure we are making a measurable positive social impact. We know that by participating in this new exchange, together we will have the opportunity to bring to life innovative health technologies that will save lives throughout the world. Thank you to WGHA for forming this much-needed exchange, and a big congratulations to all of tonight's finalists.
Well, and thank you again to Adastral. Well, finally, I would like to transition to this year's Rising Star Award. And this year we had an incredible lineup of finalists for the Rising Star Award. This Rising Star Award is awarded to an individual under 40 who is making an exceptional impact in the field of global health. And our finalists for this award this year are Claire Guay-Chare and Linda Osesso, Women in Global Health, WGH, Seattle Chapter Co-Chairs. Woo! Cyrus Mogo, University of Washington and Kenyatta National Hospital. Sarabi Rajaram, Bill and Melinda Gates Foundation. We are so grateful for all of our nominees and for our finalists for this year's award. After extended deliberation, our judging committee this year has made a selection for this year's award. Our winner for this year's Rising Star Award is Sarabi Rajaram, Bill and Melinda Gates Foundation. Congratulations so much. Until hours ago, Sarabi was going to be here, but is feeling under the weather, can't join us right now. And so we have a celebrity guest to join right now, who I'm told has prepared a 30 to 45 minute acceptance speech.
WGHA, and thank you, the Gates Foundation, for this wonderful opportunity. Like Fred said, we just heard from Surabhi maybe a few minutes before our event started that she could make it. So I do not have a formal thank you speech, but I would like to thank each and every one of you who have contributed to the global health agenda and for the opportunity to have worked during the pandemic, because that's what Surabhi did, was working through the global supply chain and getting the vaccines to the most needed places. And if she were here, she would be able to tell you all the things that she had to go above and beyond her regular daily life to do that. So with that, thank you very much. I accept on her behalf, and anyone from the Gates Foundation that you are here today, thank you.
And now I'm going to hand the glass back. All right, thank you, and congratulations again. We're so grateful again for everyone's work, and especially our finalists, our winners. Thank you for all that you're doing in the global health community. Well, can we give a big round of applause to all of our 2022 Global Health Impact Award finalists and winners? As someone who lives on the globe, I'm very grateful for all that you do. So thank you, thank you, thank you. I know, yes, I mean, I have an impact in this room, but you have such an incredible impact on so many communities and people around the globe. So thank you, truly. We know it's a school night. We want to let you go. Thank you again to the Burke Museum for staying late to host us tonight. The museum is going to be closing shortly, but first, we're going to bring up the rock stars from the WGHA team to the front of the stage. These are the people behind the connections, the conversations, and your experiences all year long. Ramadan Asi is here, or unable to join us, rather. He is currently in Istanbul, but a very integral part of the team. Megan Batillion, of course, Jasmine Davis, Maya Hamda, Kayla Jan, Maurizio Vecchioni. Thank you so much for all that you do. Get to know these lovely people right here. In fact, we're going to throw up a QR code if you would like to make a donation, or you can let any of these people know if you're interested in making a donation. Everyone, thank you for being here. We look forward to seeing you again next year. Tell your friends, tell your colleagues about all that we're doing, and have a great night. Thank you, everybody.